Welcome back. We're talking all about MountainStar Clinic, but we're talking with orthopedic surgeons, and it doesn't necessarily mean that you are going to need surgery. We're talking with Dr. Beck and Dr. Mariani, two separate orthopedic clinics, but you're coming together under the MountainStar umbrella. Thanks for being here, you two.
Thank you.
Appreciate it. Now, first things first, I mean, I want to talk about just, when would someone need to go and see an orthopedic surgeon? What are some of the issues I might be having?
Well, let's say you're skiing and having a good time, and all of a sudden something snaps in your knee and it swells up. That's a pretty good time to start thinking orthopedic surgeon is the place I need to see.
Do you find that some people that might happen and then they just hope the swelling goes down, put some ice on it, and then it happens again, or does it stay and they just deal with it?
All the time, or they may spend a night in the emergency room trying to figure out what's going on. And so, you know, maybe you should think of an orthopedic surgeon as your primary care joint specialist.
I like that. I like that. So whenever my joints are having an issue, come and see you. Now, Dr. Mariani, if I come to see surgeon, does that mean I'm going into surgery?
No, Jenny, absolutely not. Most of the time, we can treat patients conservatively initially.
Really?
And then it's only if those conservative measures fail to continue to give relief that we start to entertain the aspect of a possible surgical intervention.
Now, is that the preferred way to do it? Is it that we'd prefer not to do surgery, or I mean, obviously it's dependent on the situation.
Yes, we always try the non-operative things first. So all of our partners have additional training in the subspecialties within orthopedics. So whether the patient is having an issue with their back or their upper extremities, lower extremities, foot and ankle, or whether they have a problem with a sports-related event, or they have arthritis and are interested in joint replacement, we will talk to them and have them see that particular physician that has the expertise in that arena, and then that person will sit down with the patient and discuss with them the options all the way from the non-surgical remedies to the surgical remedies. Okay.
Now, we live in an outdoor state where a lot of people are getting outside. Dr. Beck, what are some of the most common things you see? I mean, skiing, obviously, your knee. Is that a common one?
I'm a knee and shoulder specialist, and you know, a lot of people do weight training, or they throw a hay bale at the horses, or whatever, or you fall off your horse or your motorcycle or your mountain bike.
True.
So knee, shoulder, ankle, elbow, wrist injuries are very, very common. Ski injuries aren't just knee injuries, they're shoulder, wrist injuries, especially with snowboarding, collarbone fractures. So, you know, broken bones, that's of course an orthopedic surgeon's purvey, but people don't always think that I sprained my ankle, maybe I should see a sports medicine specialist.
True.
Because sports medicine specialists are trained to get that person, whether it's an athlete or a weekend warrior, back into sports more quickly.
I like it, and that's the way to do it. Now, both of you coming together under this MountainStar umbrella, what's the big reason we should come to MountainStar versus another clinic?
Well, we have assembled, we think of it as the best of the best. We have assembled fellowship-trained physicians. Our experience ranges from anywhere from 10 to 30 years of experience. We have fellowship-trained doctors. Fellowship means the doctors have done their orthopedic surgery training, which is 5 to 6 years, and then they've done an extra year or two in a specialty. So a hand specialist does hand surgery. A shoulder and knee specialist is going to do that. A sports medicine specialist knows all of the different sports injuries. Foot and ankle specialists, and then we have joint specialists, joint replacement specialists.
I love it. So Dr. Mariani, as we're hearing, a lot of experience with your team coming together. Tell us a little bit about your team.
Well, so Charles and I both are within groups that have a lot of, we've been here a long time. And the exciting thing that's going on now is that we can bring our two groups together. We can associate under the MountainStar umbrella, if you will, so that we can offer patients up and down the Wasatch Front the option to see a orthopedic surgeon who specializes in a certain area, so we can provide that expertise at a location that's comfortable for them.
And I like it, just like you said, it's very specialized. You're going to feel very confident going in that, hey, you specifically know what you're doing if it comes to my knee or my wrist or my elbow, whatever it might be. That's your area of specialty, and I think that's a great thing for people to rest assured, whether it's needing the surgery or needing something else. So I love it.
Well, as Dr. Mariani said, we see a patient and we get them to the right specialist.
Good.
We don't try to just manage it ourselves if it's not really our expertise.
I love it. Good for you guys. Well, Dr. Beck, Dr. Mariani, thank you so much for coming in. And where can they go for more info?
they can go to
MountainStarOrtho.com. I'm going to save you right there. Right there. They don't need to know it, right? You guys need to know it. Hey, you guys, thank you so much for coming in.
Thank you very much.
Thank you so much.